Okay, so today I have a medication order provided to administer some regular insulin to a patient. So before I start with any of the medication administration, I'm going to go ahead and wash my hands. So this medication order is for the patient Carmen Guadalupe. Their patient ID number is 535451130. Their date of birth is 2/2/92, and he's allergic to morphine. This order is for regular insulin, dose or concentrated at 100 units per 1 milliliter, to be delivered subcutaneously as needed based on their fingerstick blood sugar values. The sliding scale for regular insulin that I will be using is provided here on the MAR. The patient's most recent fingerstick blood sugar level was 355, and it is currently 1100. So now I'm going to go ahead and collect all of the supplies that I will be using. So first, my tape, which I will be using to create a medication label later, some clean gloves, some alcohol swabs, which on the box it says that the expiration date for these alcohol swabs is 8/21/2019, so technically these are expired. In a healthcare setting, I would not use these, but for the sake of this situation, I'm going to go ahead and use these alcohol swabs. Now I'm going to grab my syringe. So here I have a 29 gauge half-inch insulin needle and syringe that comes pre-prepared. Its expiration date is 6/30/2023, so this is not expired. The packaging is intact, not damaged in any way, and it's unopened, so its sterility is maintained, so this should be safe for me to use. And finally, I'm going to go ahead and pull my medication. So first, the drawer. So my patient's name is Carmen Guadalupe. Their date of birth is 2/2/92, and their patient ID number is 535451130. So all the information on the drawer matches my MAR. So I'm going to go ahead and pull medication from that drawer. Here I have a vial of regular insulin, which is what we need to be giving right now. And the expiration date on it is May of 2026, so it is not expired. And the vial is intact, it's not broken, so there's nothing compromising the integrity, so the medication in this vial is safe to give. Alright, so now for calculating my dosage that I need to be giving, because this is a regular insulin order, I will be dosing it based on the sliding scale for regular insulin administration, based on the fingerstick blood sugar of my patient. The most recent fingerstick blood sugar level that was taken was 355, and according to the scale that I was given, any fingerstick blood sugar levels between 351 and 400 should receive 20 units of regular insulin, so that is how much I will be giving. So just to double check, the patient's most recent fingerstick blood sugar level was 355. According to the regular insulin sliding scale, I should be administering 20 units of regular insulin subcutaneously at this time. Okay, now I'm going to go ahead and complete my first med check. So my patient's name is Carmen Guadalupe, date of birth is 2/2/92, patient ID is 535451130. He is allergic to morphine. We are giving regular insulin, so that does not interfere with this allergy. Okay. The medication ordered is regular insulin concentrated at 100 units per 1 milliliter to be delivered subcutaneously to the patient. The medication that I have pulled from the drawer is regular insulin concentrated at 100 units per milliliter. Its expiration date is May of 2026, so it is not expired, so it is safe to give. I will be administering this subcutaneously in the lower right quadrant of the abdomen, assuming that there is nothing in that location that would warrant giving it somewhere else. According to the patient's most recent fingerstick blood sugar level being 355, I'm going to be administering 20 units of regular insulin at this time, and it is currently 1100. Okay, now I'm going to go ahead and do my second med check. My patient's name is Carmen Guadalupe. Their date of birth is 2/2/92. Patient ID is 535451130. He is allergic to morphine. Because at this time I will be giving regular insulin, This does not interfere with the allergy, so it is safe for me to give this patient. The medication ordered is regular insulin concentrated at 100 units per 1 milliliter to be delivered subcutaneously. The medication that I've pulled from the cart that I have in my hand right now is regular insulin concentrated at 100 units per milliliter. We have already checked, it is not expired, as the expiration date is in May of 2026, and I will be delivering this injection subcutaneously into the lower right quadrant of the patient's abdomen unless I see reason not to. Based on the patient's most recent finger stick blood sugar level reading 355 and the sliding scale for regular insulin administration that I have provided on my MAR, I will be administering 20 units of regular insulin at this time, and the current time is 1100. All right, so now I'm going to go ahead and prepare my medication for administration. So I'm going to start by cleaning off the top of my vial. And just to double check, this needle does not expire until 6/30 of 2023, so it's not expired, and the packaging is intact, it's unopened and undamaged, so it is safe to use this needle. So I'm going to go ahead and open it up. And now, because I'm administering 20 units, I'm going to go ahead and draw up 20 units of air. Now that that is prepared, I'm going to go ahead and pull out my medication. I'm going to start by injecting the air into the vial. Now I'm going to withdraw 20 units of regular insulin from this vial. I'm going to drop a little bit more because there are air bubbles present. To remove the bubbles. Okay, all of the bubbles have been removed. There's a little bit of extra liquid in here, so I'm going to go ahead and, okay. And I can remove my needle and do a one-handed recap. Okay, and here we are. I have prepared 20 units of regular insulin. All right, now I'm going to set this to the side, and I'm going to go ahead and make my label to go on to the medication that has been prepared. So this is for Carmen Guadalupe. It is regular insulin, concentrated at 100 units per 1 milliliter. Based on my calculations and the sliding scale provided here, I will be administering 20 units at this time. Today's date is February 10th, so 2/10 of 2020. It is currently 1100. And I will go ahead and initial. Okay. Go ahead and put this. So here is the label that I have made. It's for Carmen Guadalupe, regular insulin, 100 units per 1 milliliter, 20 units. Today's date, the time is 1100, and my initials. Okay, so now I have completed all of the preparation, so I should be ready to go into the patient's room as soon as I put this medication away. So just to double check the drawer that I'm putting this in, the patient is Carmen Guadalupe. Date of birth is 2/2 of 92. Patient ID is 535451130. So this is the correct drawer. And I am replacing a vial of regular insulin, 100 units per milliliter, which is what I have in my hand right here. Okay. So now I'm ready to go into my patient's room. So I'm going to take with me my MAR, my medication that has been prepared, my alcohol swab, and my gloves. All right. So now I'm going to enter the patient's room.
Come in.
Hello, my name is Rachel. I'm going to be your nurse today, or your student nurse today. How are you doing?
I'm good. How are you?
I'm good, thank you for asking. At this time, I'm going to wash my hands. All right. Before we get started, I have a few questions for you. Would you mind stating your name and date of birth for me?
Carmen Guadalupe, 2292.
Okay, perfect. And when the patient was stating that, I was checking their armband. Their armband does match what they said. And just to double check their identity, I'm going to check the armband with my MAR. So the armband says Carmen Guadalupe, 2/2 of 92. My MAR says the same, Carmen Guadalupe, 2/2 of 92. Patient ID according to the name band is 535451130. And the ID according to the MAR is 535451130. So they match. So this is indeed the correct patient. Okay, Ms. Guadalupe, can you please tell me what you are allergic to?
I'm allergic to morphine.
Okay, perfect, that is correct. That is what is written on my MAR here. And then I have a couple questions to ask you.
Okay.
Can you tell me where you are right now?
The UK College of Nursing.
Okay, and can you tell me what day of the week it is today?
Monday.
Perfect, okay, so that would indicate that this patient is alert and oriented. All right, so now I am safe to do my third and final med check. So this order is for Carmen Guadalupe. Date of birth is 2/2 of 92. We have verified that this is the correct patient, and I have in my hand a medication that I have prepared for Carmen Guadalupe. The order states that this should be regular insulin at a concentration of 100 units per 1 milliliter to be delivered subcutaneously. In my hand, I have regular insulin at a concentration of 100 units per 1 milliliter in a syringe that has a needle attached to deliver this medication subcutaneously. According to the sliding scale of insulin and the patient's current fingerstick blood sugar levels, I am to deliver 20 units of regular insulin, and I have prepared 20 units of insulin here. It is currently 1100, which is when this is prepared to be delivered. Okay, so I will be giving this injection in the lower right quadrant of the abdomen. Upon inspection of the patient's abdomen while I'm putting on my gloves, there is no bruising or redness or swelling and any indications of infection. So I should be safe to give it in this area. I'm gonna go ahead and grab my alcohol swab. I'll open it up now so that it's ready. Set that to the side. I'm gonna measure 2 inches from the umbilicus and go ahead and clean in a circle. Okay. Leave that to mark my spot, which is right in the middle. And I'm gonna go ahead and check one more time. This patient is Carmen Guadalupe. We have verified their identity with the MAR, and I have medication here for Carmen Guadalupe. Okay, so I'm ready to administer this medication. So I'm gonna go ahead and remove the cap, put it to the side. I'm going to remove the alcohol swab. My location is right here. I'm going to pinch up the skin. I am able to pinch up 2 inches of skin, And so I'm going to deliver this injection at a 90-degree angle. All right, on the count of 3, I'm going to give the injection. 1, 2, 3. Okay, now I'm going to stabilize and I'm going to give the injection steadily and slowly. Okay, now I'm going to go ahead and remove the needle, engage the safety. I would apply pressure if there were to be any blood or any fluid return after removing the needle. Okay, now I'm going to dispose of this in the sharps container. Okay, I'll remove my gloves. Oh, and I should have stated at the beginning that I would have adjusted the bed to be the correct height for me to easily work, and I would have lowered the bed rails on the side on which I am working. So now that I'm finished with the patient, before I lower the bed, I would ask if there was anything else that I could do for them. So, Mr. Guadalupe, is there anything else that I can do for you?
No, I'm good.
Okay, so now I will leave the patient's call light. I will leave your call light right here. If you need anything, just let me know. I would raise the bed rail, put the bed back down, and lower the bed rail. Then I would dispose of all of my trash. And I would wash my hands. Okay. And now I'm going to go ahead and fill out my MAR so that I have correct documentation of that medication administration. Okay. So I administered regular insulin at 1100. I delivered 20 units because the finger stick blood sugar level was 355. I delivered this injection in the lower right quadrant of the abdomen, and I will go ahead and sign my name. And I have already provided my initials and my signature along with my title of UKSN for UK student nurse at the top of my MAR. So this is my final documentation.